The ICMR-Vector Control Research Centre, or VCRC, located in Puducherry, has been at the forefront of research on vectors and vector-borne diseases for nearly 50 years. Its seminal contribution to combating major public health challenges like malaria, lymphatic filariasis, dengue, chikungunya, KFD, etc. have shaped policies and programs in the country and globally. At the heart of VCRC's research is a focus on working closely with communities and primary health care systems. One example of this is the elimination of lymphatic filariasis transmission in Sherthalai, Kerala through PHILCO, an innovative community-based movement that utilized an integrated vector management strategy along with mass drug administration and community mobilization. The centre was instrumental in the demonstration of the use of the mass drug administration and DEC fortified salts as a strategy for fighting lymphatic filariasis and has conducted field trials to provide evidence for the same. VCRC maintains a colony of Brugia malai to aid in research on filarial worms. The centre is committed to filariasis elimination in the country and runs field studies to provide evidence to strengthen the national program, including transmission assessment surveys, IDA-MDA field trials, and validation of test kits. The Puducherry headquarters also runs filariasis clinic to support the morbidity management and disability prevention strategy of the elimination efforts along with innovative approaches and health education for the patients. VCRC has also set up a model rural health research unit to promote collaborative research with ICMR to benefit the rural population in Puducherry. VCRC's systematic phonistic surveys have led to an outstanding understanding of the biology, behavior, and ecology of major mosquito vectors. The National Mosquito Museum at VCRC is one of the most comprehensive mosquito collections in Southeast Asia, with over 350 species and 150,000 mosquitoes. The centre is soon to be licensed by WHO as one of the 3 facilities in the world for the production of insecticide-impregnated paper used for testing mosquito insecticide susceptibility. The centre's cutting-edge research has developed over 25 technologies and prototypes that will eventually be transferred to industry partners. ICMR-Vector Control Research Centre is a good laboratory practices certified test facility in compliance with NGCMA and OECD principles of GLP for Phase 2 evaluation of long-lasting insecticidal nets. There are 13 experimental huts and a net washing facility built and maintained by VCRC for the evaluation of these nets. Another example is an effective biolarvicide based on Bacillus thuringiensis var. Israelensis bacteria, which has been licensed to several companies and adopted by the national program. This B17 strain of BTI is recognized as the Indian standard strain by the Central Insecticide Board of India. VCRC is involved in Wolbachia research to aid in disease prevention strategies. The centre has also pioneered the application of geo-environmental risk mapping to inform disease control. The centre houses a state-of-the-art rickettsial and arboviral laboratory involved in the production of diagnostic kits, metagenomics, cell culture and screening studies. Focusing on One Health, the centre is expanding its ambit into zoonotic and environmental health. VCRC is establishing a new central instrumentation facility and is involved in studies on preventive strategies, integrated vector management, molecular epidemiology of various diseases, microbiological agents, screening of diseases, omics, metagenomics, diagnostics and vaccine development, modeling studies, newer drugs and products, bioinformatics and a gamut of technologies to ensure a healthier India free from vector-borne diseases. VCRC's research responds to India's urgent needs for vector management by demonstrating site-specific vector management strategies for malaria, dengue, chikungunya, Kala Azar, KFD, JE, scrub typhus and others, evaluating vector control products and developing decision support tools to scale up integrated vector management models nationally and help strengthen the National Vector-borne Disease Control Program. With strategically placed field stations in Kottayam in Kerala, Koraput in Odisha and Madurai in Tamil Nadu, VCRC is well placed to respond to vector-borne disease emergencies. The field stations also perform substantial research in the local areas, independently providing support to national programs in hilly, difficult terrains and tribal areas. VCRC is committed to capacity building, offering an MSc program in Public Health Entomology and customized training for national program officers. The Centre coordinates the National Public Health Entomology MSc program in 5 other ICMR institutes. Affiliated to Pondicherry University, VCRC also conducts robust PhD, postdoctoral and research fellowship programs. It also collaborates with WHO to train program workers in the Southeast Asia region. ICMR-Vector Control Research Centre is the WHO collaborating centre for research and training in lymphatic filariasis and integrated vector management. The centre also has strategic partnerships with leading global universities and research institutes. VCRC has signed over 10 MOUs with various institutes for collaborative partnerships. The ICMR-Vector Control Research Centre is now building the International Centre for Excellence for Training in Medical Entomology, ICMR, which will build entomological capacity in Southeast Asia and globally. The scientific footprints of VCRC are ever expanding. As ICMR-VCRC continues to innovate the vector-borne disease control through an integrated vector management approach, its research remains crucial to protecting health and saving lives in India and globally.